Welcome to the HIV Complexities webinar and community online gathering. And let me just share my screen. People, if you want to submit Q&A, please feel free to do so. Here are some instructions on how to, oops, that's not what I meant to do. Submit your Q&A at the end of the panel if you can. Q&A will begin at around 7:30, or write down your questions and hold on to them, send them in. You will also have the chance to unmute yourselves later and have a community conversation. So without further ado, I'm going to stop sharing my screen so that we can ensure that our wonderful ASL interpreters are in the recording for posterity. We have had it in the past where the interpreters don't show up in the recording. So we want you to see what's on the screen, but also we want to keep the interpreters in. So welcome to the first HIV Complexities webinar. I'm going to just tell you a little bit about the project. The project is certainly ambitious. We seek to start conversations and do advocacy and community building for people living with HIV and other complex chronic conditions or comorbidities, such as chronic fatigue, chronic pain, and many other frailty and many other conditions. Basically, things that impact our quality of life and are pretty much left out of a lot of conversations surrounding our lives with HIV. Because as many of you are familiar with, we're likely a lot of the times reduced to our viral load and our CD4 count. And that doesn't really tell the whole picture. It's important, it's a baseline, but it's not everything. And so we are in this project putting together some patient-led resources created by people who are affected by the problems that the resources are speaking about. We also are hosting a support group that is weekly. Right now we're piloting the drop-in model. So if you want to, you show up when you can, as you can. All we ask is that you show up on time. And we have other elements to this program that are related to advocacy so that we can begin to start disability justice and quality of life conversations in the places where decisions are made about our lives. So today, before we start our conversation with our great panelists, I want to introduce you to the HIV Complexities Toolkit. That is a toolkit that was created by patients, and then it was reviewed by medical professionals for accuracy. But the language in the toolkit is simple, it's accessible, and most importantly, it does reflect our lived experiences. So I hope that you find it useful. The links will be put in the chat. Again, I will share my screen briefly, and then I will stop sharing so that you can, and the recording has the interpreters in it. So this is what the toolkit looks like. As you can see, it's for people who are living with HIV and chronic illness. And it's targeting chronic fatigue, brain fog, pain, memory issues, etc. That's a brief introduction. And here are the info sheets. Each sheet is has a link that will take you to the full resource. I will let you check them out on your own. But what I can tell you about them is that because they're this project came because the HIV community has disproportionate rates compared to our seronegative counterparts and other chronic illness communities of chronic pain and chronic fatigue. So in this first toolkit, we have resources that talk about long COVID, which if you have heard, it's when symptoms continue, worsen, or onset after a COVID infection. And it's difficult to diagnose and it's difficult to manage. So here are some resources for that. And then we selected some resources about brain fog and myalgic encephalomyelitis or ME/CFS, formerly known as chronic fatigue syndrome, because these are complex chronic conditions that generally have an infectious onset. So somebody comes down with an acute infection, whether viral or bacterial, and following that, they don't fully recover or begin to develop other symptoms such as chronic fatigue, chronic pain, malaise, um, dysautonomias, etc. So our toolkit really includes the most prevalent and underdiagnosed complex chronic conditions like ME/CFS and long COVID, and also a symptom tracker because very often our experiences tend to be dismissed by medical professionals. So tracking your symptoms becomes incredibly important. We here want to assure you, we believe you, we see you, we know that you're the expert in your body and your experience. And so we are creating these spaces and these toolkits in order to both validate each other, form community, and share what works and what doesn't work when the medical community is still either not believing us or maybe just they don't have good answers for us. So in community, we can find support and management strategies. So that's enough from me. And let's go to our wonderful panelists who have a wealth of experience and are mostly located in the South. We want to bring not just um, racial diversity and a diversity of experiences, but also geographical diversity into these conversations. So a lot of our panelists are located in the South because Southern and rural experiences are often left out of conversations, and it's where we are finding higher rates of HIV. So our first speaker, well, I'm just gonna name them and they can talk in the order that they want, but TORI Cooper is our um, one of our first speaker. She is the Director of Strategic Outreach and Training at the Human Rights Campaign. She was a member of PACHA, the President's Council Advisory Council on HIV and AIDS, and she is a steering committee member of the HIV Caucus. We also have Sylvester Askins Jr., former training director at the National Working Positive Coalition, and founder of Moving Forward Consulting. Um, then there's Broderick Disrow, which I think, I don't know, you go by Broderick, um, former community navigator and harm reduction specialist at the Western North Carolina AIDS Project. And he's also a talented esthetician with many, many years of experience in the beauty industry. And John Chaffin, okay,
You
community
can
health
chat
worker.
potato potato. It's okay.
Oh, thank you. Health worker, program coordinator, with Western North Carolina AIDS Project. Welcome all. Um, Apologies for my brain fog. It's that time of the day, but um, I hope that no, I don't hope that many of you can relate, but those of you who can't relate understand. So, without further ado, let's let our speakers introduce themselves and tell us where they feel most rooted in community. Um, and we'll start with Tori. Miss Tori Cooper, please.
Thank you so much, Gabriel, and thank you to the interpreters who are doing amazing work and to all of my co-panelists. So, where do I feel most rooted? I feel most rooted in places and spaces where I am needed. I think that's the best thing. Places, and when I say that, I mean that in the most humble and respectful way. It is, for some of us, it is our life's mission to be a vessel, and so I feel as our advocacy continues to transition, for lack of a better word, notice the flag behind me. But as our advocacy continues to transition, I think it's imperative that none of us stays in the same place forever, that we find new ways to advocate and new folks to advocate for and with. The world is progressing and also regressing at the same time. Being an older woman who happens to be trans, I think it's also imperative to reach back to some of the things that help to get us over, as we would say in the Black church. So yeah, so that's it. So that's what keeps me rooted. I'm rooted in the transition of advocacy.
Thank you, Tori. That's great. Sylvester, would you like to share with us where do you feel rooted? What part of the community do you consider to be closest to you?
Good evening, everyone. Hi, Tori. Hi, Gabriel. And thank you all so much for allowing me this opportunity to be with you tonight. It's a wonderful opportunity. So I feel most rooted in my faith. Because 15 years ago, I decided that I would spend the rest of my life in celibacy because that was the way that I wanted and needed my life to go at the time. But that's on a personal level. But as far as the community is concerned, my main hope and focus is on economic stability. I'll talk about that a little bit more as we go on. But many of us living with HIV live in poverty, and we don't have to. And that's been something that's been a real focus of mine for many, many years now. And we'll talk about that a little bit later on. Thank you.
Thank you, Sylvester. Um, Brody, would you do the honors? Where do you feel most rooted, or what community do you consider closest to you?
Thank you so much for having me here tonight. It's an honor to be a part of such important discussions, and I'm just grateful to have the opportunity to speak for marginalized groups. And I feel most connected to the BIPOC, queer, trans, and non-binary community. Um, my focus has always been about self-care, mental health, and physical health, and having a great support system. So that's what I like to focus on for myself and for the people that are closest to me.
Thanks, Brody. Is it okay, Broderick? Is it okay if I call you Brody?
Yes, it's fine. Thank you.
Thank you. And John,
Hey everyone. Yeah, thanks for having me. It really is an honor, just as Broderick said, it is an honor to be here tonight. I guess I could say I'm most rooted here in Southern Appalachia with the queer community here. I have a passion for working with queer folks in Southern Appalachia, but also with HIV with myself. Um, but also the research that I do, and along with Wake Forest University and West North Carolina AIDS Project. And I guess the community advocacy aspect of my work really has helped me grow roots in this region and made this place my home. So
thank you, John. So, by the way, speaking of brain fog and access and accessibility being a process, not a destination, right? It's all journey. I totally forgot to introduce myself. I'm Gabriel Sanemeterio, and I'm the project lead at the HIV Complexities Project. Hard who led the grounding has been helping us with the project and helps me co-facilitate the group. And we also have the rest of the team from Long COVID Justice here helping. So thank you all. I am a light-skinned Latino or Latina with curly hair, a gray streak, and I'm wearing a headset. And my background has the Disability Pride flag. So I'm going to ask every speaker to please just, before you answer the next question, if you could also give us a brief verbal description of yourself, of your beautiful selves. And so, living with HIV and other chronic conditions, what are the current issues that you feel are facing you and the community where you're based and the people that you work with? So let's go to Tori first.
Repeat the question again. So, one more
Yes.
time.
Living with chronic illness and HIV, what are the current issues that you are facing you and that you see in your community?
So, great question. So first, I will describe myself. I am the most ravaging, uh, darker than a brown paper bag black trans woman that you have ever seen in your entire life. Um, there you go. I am pleasantly plump. And so there's my description, and I have curly hair, and full lips and strong African features. So with chronic illness, I think it's always important to understand HIV itself is a chronic illness, and having an HIV diagnosis actually can increase the likelihood, or does increase the likelihood, that people will have other chronic health conditions as well. I see in the chat that Gabriel, one of Gabriel's chronic health conditions is named there. One of the things that happens with HIV is your body is continually fighting the virus 24 hours a day, 7 days a week, every single day. And so chronic inflammation is one of the very first things that comes to mind. And many people who are living with HIV experience chronic inflammation. It could be inflammation in the joints, it could be of the organs, all kinds of ways it impacts people's ability to move and function. In addition to that, with your immune system working so hard all the time, I'm also trying to speak slowly for the interpreters because I'm Southern and I speak fast. Um, for many people, that chronic inflammation leads to feeling more tired. And for some people, feelings of exhaustion um, that perhaps don't always go away with rest. And so I think that's the very first thing that comes to mind. And for some people, depending on lifestyle, depending on your medical history, depending on your family history, inflammation itself can be really debilitating. For some, it isn't so much, but for others, it is. And so, for every person who's living with HIV, particularly folks who have had HIV for a long time, it's amazing to see how inflammation shows up in your daily life. And it's also a bit scary as well.
Thank you, Tori. Um, so true. And now with COVID around, exacerbating inflammation for all of us. Um, yeah, we started with long COVID as an in for the most current crisis, but we are definitely expanding because our goal was always disability justice and quality of life for all people living with disabilities and chronic illness. So I see Brody spotlight, so I'm gonna ask you, Brody, and then we'll go to Sylvester. If you want to tell us about living with HIV, with other chronic health issues, and how do you see that impacting you and your community?
Again, my name is Broderick Disrow, and my pronouns are he, him. Um, I have been living with HIV since 2009, and um, of course, this is a journey, so we're always trying to figure out how best to take care of oneself. And so I find that diet and exercise and choosing to prioritize yourself is how one of the ways that I take care of myself. One of the ways that I administer self-care to myself. Some of the current issues that I believe my community faces is affordable housing, um, food insecurities, and gender affirming care. With this administration and a lot of the changes that are happening in the world, um, things are tough. And if you don't have the foundation of home and food, it makes things even more challenging. So I rely heavily on some of the resources that we have here in Western North Carolina and Asheville, like Loving Food Resources and Western North Carolina Community Health Services for services and um, to fill in the gaps of some of those needs. It's very important for me to share those resources because a lot of people don't know what's available. Part of my background has been connecting individuals to those resources. And because of those experiences, I know how to advocate for myself and for others.
Thank you, Broderick. And we would be happy to share any of those resources. We'll collect them from all of you later so that we can share them with all the people who joined us tonight. Sylvester, if you could provide a description of yourself and then tell us about your experience with HIV and chronic illness.
Yes, I will. I am a bald-headed Black man who is about to celebrate my 70th birthday in about 9 days with a few extra pounds around the middle. Living with HIV and other chronic health conditions. So I've been living with HIV for 35 years now. So I'm on the back end of that first set of long-term survivors. So the virus has had an opportunity to wreak some havoc in my life. You know, I have rheumatoid arthritis, have a very rare lung disease called lymphocytic interstitial pneumonia, which is different from regular pneumonia. It doesn't allow me to exert myself but so much, and some other chronic conditions. But I live in Virginia in the Hampton Roads area, just outside of Norfolk. And this is considered an urban area, but that's not what I would call it. But I think one of the issues the community has here, we have a lot of long-term survivors here, and finding care for the aging individual with HIV is a real problem. For 4 or 5 years, I tried to get a geriatric assessment and was not able to because there wasn't anybody in the area. As you guys may or may not know, there is a lack of geriatricians across the United States. Of the a little more than 1 million board certified doctors in the US, only about 7,000 of them are board certified geriatricians. So I had to go outside of the area. I'm in Norfolk. I went all the way to Baltimore to get a geriatric assessment. Many people in my area are not able to do that. So finding the right kind of care for the stage of life that we're in, I think is the main issue for my community. Thank you.
Thank you, Sylvester. And yes, we appreciate your energy and everybody's energy for being here and spending this evening with us or checking out the recording. John, if you could give us your lovely description and your experience with chronic health conditions and your community.
Sure. I go by he, him pronouns, and I'm wearing a red flannel shirt, a pair of glasses that I can't seem to keep on my face, and I have short hair. I have a bookshelf in the background with my plants. Um, So yeah, my experience with chronic conditions is mostly just HIV. I spoke a little bit last week in another webinar about my recent experience with Lyme disease. Though I don't have the lingering conditions of it, HIV is one of those chronic conditions that I had faced for about 6.5 years now, 7 years now. But I've been working in this field for but a little bit longer than that. Um, I would say some of the things that we face in our community about one, starting off is stigma, especially in rural areas, um, which is tied directly to health literacy and HIV literacy. Um, so education, I think, is extremely important. Educating our neighbors on what it means to be living with HIV, how that works. I encountered someone, a good friend of mine, the other day who just didn't know. He only thought that gay men got it. So it's and nothing against him. He was an educated outside of that field and just didn't know much else when it came to HIV. So it was a great opportunity to educate our neighbors, right? And I'll probably discuss more about our community and neighbors later, as that's, I guess you could say, my Roman Empire, as some say. It's a heavy focus of mine. But yeah, health literacy is extremely important. Um, and For here in Southern Appalachia, transportation is a huge issue that we often don't really consider about accessing care. It's a barrier to care and a barrier to access to the HIV care. Um, and Isolation. Sylvester mentioned as we age, it becomes harder for folks living with HIV. Well, not only that, in a rural area, it's like Southern Appalachia, especially here in Western North Carolina, isolation just compounds that. And we have folks who are just living all alone in communities without a lot of community attachment, living with HIV, and that itself compounds those structural barriers.
Thanks, John. Yeah, and in addition to living with HIV for a long time, having a disability in any area, I mean, New York City too is pretty inaccessible for people living with disabilities. So isolation is definitely a problem that I think as we reignite our movement for better advocacy, we need to also ensure that our advocacy networks um, build connection and mutual aid. So we're going to make another round of questions as to like, how has your advocacy changed, or how do you see it anticipating some of the budget cuts and policy changes that are happening? And if that's tricky, just tell us exactly how you're coping, how your community's coping with the changes that we're facing. Tori?
First, I will breathe because this is a tough one. It's a tough one because as the trans community and gender expansive community, particularly people who are living with HIV who happen to be trans or happen to be gender expansive, we're already suffering. We're folks who are at the bottom of the totem pole, as it were, in terms of political cap and social capital. There's so much disinformation and misinformation that's put out about trans and gender expansive people, and this administration who's only exacerbated and sped up the process. And so when I think about budget cuts and policy, I immediately think first of all, it doesn't even seem real. And then I am reminded this isn't about trans people, it's about control. It's about control, and they're using trans people because there's so many folks in the country who say we don't know trans people. We've never met trans people. We don't have trans people in our families or in our neighborhoods or in our schools. And so it's easier for them to believe the misinformation and disinformation. And let me also clarify why I use the terms misinformation and disinformation. Misinformation is when you make a mistake. Gabriel, you asked me where the local 7-Eleven is. I said you go outside of my subdivision, you make a left, and then you make another left, then it's 3 blocks down. I didn't intentionally mislead you, I just sent you the wrong direction. But disinformation is willful intent to lie and deceive, to trick people. And so there's a lot of both. There's misinformation for people who don't know any better, and then there's disinformation largely from the Republican Party from people who do know better. People who are using disinformation to create policies that only impact trans people now, but will eventually lead to policies that negatively impact every other community of people. Roe versus Wade, I don't have a uterus. I'm a trans woman. I don't have a uterus. But I also understand that Roe v. Wade was one of the things that it empowered them because it was about controlling women's bodies. And so, as a woman, I know that these policies, these bathroom bills that are being put forth, these bills about these executive orders, not even bills about being able to change one's gender marker and being able to have affirming health care, because every person has some type of health care, affirming health care. If you're a man, assigned male at birth, you live as a male, and you get a prostate exam, that's gender affirming care. If you're a woman, assigned female at birth, and you get a mammogram, that's gender affirming care. And so for trans people, it's so much of it is about control. And I also believe, and many folks in my community believe that we're being used as test dummies, if you will. They're testing to see how far they can change the rules in order to manipulate and impact the lives of every single individual that's represented on this call. There's people who are living with HIV, BIPOC folks, queer people, people who are living with impairments, and etc.
Yes, thank you so much, Tori. And absolutely, cisgender people don't realize how much they have their gender affirmed on a day-to-day basis, both with the care they get and when their pronouns are respected and when they're just seen for the gender they are. Their gender is affirmed constantly, and therefore it goes unnoticed to them. Um, so things to consider. Broderick, would you like to,
Sure.
should I repeat the question?
Yeah.
Or yeah. Um, so with the budget cuts and policy legislative changes, um, how do you see or anticipate your um, current advocacy or your community taking proactive steps to face these changes? And if not, like what's happening in your community in regards to these upcoming policies?
Sure, I take the mindset and the approach of um, there's only so many things that you can affect or control, and so instead of looking at the big picture, try and support your local community. Try and affect the change where you can, and if that's just a small group of friends, educating them, sharing what you know, sharing what you do to protect your mental health. Um, I think that a lot of us have so much to give and feel is that I feel as though um, there's nothing we can do, but really it's about sharing and affecting the type of change that you can with your peer group, your community. And so that's what I do, and I try to um, do the best that I can with the people that I know.
Thank you.
Thank
Yeah, mutual aid is important at the local level. Absolutely. Sylvester?
Yes, I mentioned earlier that many of us living with HIV are living in poverty. And it's my fear that with these ongoing budget cuts and reductions that are happening, it's only going to exacerbate the amount of us who are living in poverty. Yeah, but the really, really unfortunate thing, I believe, is that many of us are living in poverty unnecessarily. Many of us don't understand that today we have the opportunity to go to work or return to work. You know, work is not for everyone, but we can't be truly whole and healthy if we're not economically stable, if our housing isn't stable, if our food isn't secure. One of the ways that we help lift ourselves up in that is that we have a steady income that is not an entitlement from the government. There's absolutely nothing wrong with being on disability. I've been on disability twice. However, had to make a decision that I wanted more for my life. Unfortunately, many of us have been told that we can't do more. Since 2016, I've been traveling across the country and across Virginia, trying to help people living with HIV understand there is an opportunity for us to go back to work if you choose to. Not that it's a must, but if it's something that you want to do, there is information and resources out there that can assist you to go back to work so you don't lose your medical benefits, your Medicaid, your Medicare, or your cash benefits, your Social Security check for a set amount of time. Thank
Yes,
you.
thank you.
Gabriel, may I interject real quick?
Yes, of
Thank
course.
you for that, Sylvester. And may I also add kind of a different perspective as well, that for some people who aren't able to work or life whose life won't support working, for people
Mm-hmm,
who have young children, for
mm-hmm,
people who perhaps live in subsidized housing, um, working isn't the best option for every person who's living with HIV. We don't tell every person
mm-hmm,
who has cancer that they should go out and get a job. And so, for those who don't, and I'll go back to what you said at first, it still shouldn't be that difficult. It shouldn't be that difficult because there is an entire system. Uh, system, the Ryan White program is there to support people who are living with HIV and AIDS so that they can live healthier lives.
mm-hmm,
Once those protections are taken away through funding and through executive orders and through policy changes, what it does is it creates unnecessary hardships for people whose income is below the federal poverty line.
mm-hmm,
However, whether they are working or not. So I just wanted to add that. Thanks, Sylvester.
mm-hmm. Sure, thank you.
Thank you. Yeah, and we should also have better policies that allow for people to take breaks if they work, if they experience episodic disability, so that they can rest, so that we can take care of ourselves and not lose our jobs and be able to take care of ourselves and stay healthy and have a quality of life. So, yes, I see Sylvester and then John.
I just want to add, when you talk about extra breaks and being able to take care of yourself, there's a little known subsidy when you go back to work and you're on Social Security disability. It's called a subsidy, which allows you to get paid the same rate as your counterpart. However, you're responsible for a little bit less work, right? And don't a lot of people don't know about that, but it's one of the work incentives that's included if you're on disability. If anybody has any questions about that, please feel free to reach out to me at a later date. But there are all kinds of work incentives. If you go back to work the right way, that can help you figure out if you're able to go back to work. And even with the Ticket to Work program, if you work a certain amount of time, I think it's less than 6 months, and you find out you can't work, you're still able to go back and start again. So you're not tied down to something, but that's a whole different conversation.
Thanks, Sylvester. Now that's all your area of expertise, and we really appreciate it. Because we were going to talk about quality of life and what's working in your communities next, but let's hear from John.
Hey there. So I don't want to speak directly on behalf of not my nonprofit, just for legal sake, on the pulling of funding. But I can say a couple of things. Um, and we have lost funding here and there for on various grants. So I'm on a research grant with Wake Forest University and the funded by the NIH. And we recently lost that grant. That funded my salary directly and helped fund our community health worker program. Community health workers are really, really important for folks living with HIV, especially in rural areas. Um, and we combine community health workers alongside peer navigators, if not trained together as the same person, um, to work with people living with HIV. Well, when we've lost that grant, that funding comes directly out of our budget, right? So it makes it a lot more difficult on us. That doesn't mean we stop doing research entirely. That project is done that we did, but there are other research initiatives that have to do with HIV and other STIs, and not just that, but other chronic conditions as well that have been cut from the NIH, and that has been um, and will become detrimental to our knowledge in the future on what we know about HIV and other chronic conditions, right? And when we cut funding from the NIH, I think it's if we put $1 into the research funding with the NIH, it comes back to us at $1.35. It's a huge return on our national investment. So when we pull that funding away, um, we see discrepancies and we see people fall through the cracks in care because we now know less about HIV. We now know less about these chronic conditions. And so that's just one example of how we've seen our funding impact our community. But we won't see a huge impact immediately as we are, but we will see a greater impact in the future as time goes on, because that knowledge helps us learn more and more about our community and HIV as a whole. So,
Thank you. And so now let's go to hopefully a brighter side. I mean, we all know this is happening and the sky's falling, and we're trying to take care of each other and take care of our communities. So what is working right now in your community that you would like to share with us? Believe we believe that um, cross-pollination and learning from other communities is very important. So, what is working in your community? What is working with your healthcare providers uh, to support people living with HIV right now? Tori, if you'd like to begin.
Thank you. I had to put something in the chat. Often the administration, understanding this is not a political conversation. Excuse me, I'm getting over a cold. But I think it's also worth noting that the current Secretary for Health and Human Services has actually gone on record and said, don't take medical advice from him. That's where we're headed. That's what I was hearing from what John was talking about, even though John didn't say that. Scientists should be determining what science determines. I know that sounds weird, but it's true. And I'm not a scientist, and I shouldn't be giving people medical advice other than take your pills, get your shot, take care of your HIV. I forgot what the question was because I went off on a tangent.
What is working in your community? What is working for your community with your providers to take care of people living with HIV?
So there are a lot of things that are working well. One of the things that's working well. So Sylvester and I, being the elders too on the call, I'm 55, and I remember we didn't call it advocacy; we called it just taking care of people. But I remember when I was young, very early in my transition and even before my transition, when someone died of HIV, complications from HIV and AIDS, we would do benefit shows when they were put out of their homes. We would make sure they had, I can't say we because I was living in my parents' house, but the girls, the community, they would hold benefit shows. They would feed them. They would bring them in and lay them on their couches for as long as they need to. And we would raise money to bury them. And so, what's working well is there are folks who are now going back to that grassroots type advocacy, if you will. There are people who are making sure that other people who are living with HIV have food that encompasses more than just fried foods and fast foods. There are people making sure that they're getting to their medical appointments, that they're in medical care. There's some providers. I'm in Atlanta right now, and there's some providers in Atlanta who are, I don't want to mention names because I don't, but there's some folks who have transferred who aren't receiving federal money now because of the EOs, but have not put a single person out of their housing program. They're self-paying to ensure that every person that's there that needs stable housing continues to get it. And so, what I think has to happen is we as a community of advocates and also as a community of providers and just as a community, we need to take care of people who need stuff. That's what empathy is. It's also really taking into account the word um, equity, meaning people who need the most get the most. And that includes healthcare, includes food, it includes everything.
Thank you, Tori. Um, Sylvester or uh,
I'll go.
yeah,
Yeah, I'll go. So locally, like I said earlier, there's a large number of individuals aging with HIV in the Tidewater, Hampton Roads area, and we're starting to have more conversations together, putting our heads together about how we can advocate to be able to get the kind of care that we need. We're talking to each other and we're talking about providers and helping people understand if that provider that you're going to is not catering to your aging needs, then you need to find a practice that will cater to your aging need. Over the last year, there have been a couple of new medical practices that have come into the area that are specifically concerned with the aging. So many of us are leaving our other providers and going to see these very age specific um, um, providers. Also, I used to be the director of health at the Urban League of Hampton Roads, and I had a conversation with the director of nursing at Hampton University, and we were talking about the fact that there aren't any geriatricians in the area. And one of the things that she was doing was trying to have conversations with her nurses who were going on to be PAs to maybe concentrate in geriatrics because there is a great need for service for the elderly. The United States in general is not ready for the geriatric generation. And then there's so many of us who live with HIV who are also aging. They're definitely not ready for us. So I think our community is starting to have those necessary conversations about long-term planning for what our care is going to look like down the road.
thank you, Sylvester. And I mean, a lot of people might know this, some of you might not, but people living with HIV, as Tori mentioned, we age faster than other people who are not living with HIV. And so right now, about 50% of people living with HIV in the United States are age 50 and older. And by 2030, so in just a few years, 70% of us will be age 50 and older. I'll be there. So um, Broderick, what's working in your community?
This is one of my favorite parts of this for me because I moved to Western North Carolina back in 2019, so I'm newer to the region, and mutual aid is working here. I was so taken back by how the trans and non-binary community, queer community, like really stepped it up to support each other and fill in the gaps in the spaces that were needed, like after the storm, before the storm. I'm really impressed by how the rebels or the outcasts or the fence liars, like the edge liars, have really come together to support and do what's needed. Um, Loving Food Resources is working. It's a place that just opened up to support the food needs for all queer people. Loving Food Resources has been providing me with food for the past 5 years, which has made it possible for me to leverage my life and make other financial gains. I purchased my first home here 2 years ago. And every Saturday, I'm able to go to Loving Food Resources and shop like a grocery store and buy the things that I want or select the things that I want. It's not pre-boxed with things that I wouldn't use, which is incredible. Like, and it's available every Saturday um, from 10 until 1. And it's fresh, grown, locally grown produce. It's enough for it's plenty of food. I never have to go to the grocery store unless there's something specific that I want or need. So they just opened this up to all queer people last week. So it's been such a joy to share with people that this wasn't available for. It was before it was just available to people living with HIV. So this is a really big deal for them to make it available to everyone. So Loving Food Resources is working. I receive my healthcare at Winches, and they have really overhauled their entire program to be more efficient, to really take into account everyone's experience, to streamline pharmacy, mental health. All of these different programs are working really closely to make sure that we're taken care of at the highest quality possible. So I'm very proud to be a part of this community because you can see that everyone, all hands are involved in making sure that the community has what it needs.
Thank you. John, what's working in your community?
So yeah, I'm going to reiterate what Broderick said as well. Mutual aid has been huge here in Western North Carolina, and I can't reiterate what Broderick said enough. It's wonderful, and that's really helped uplift a lot of folks. But I also say that community health workers, trained community health workers, and peer specialists, especially peer specialists who work with people living with HIV. I said this just a few minutes ago as well, but working with folks living with HIV in rural communities, as folks age, as Sylvester also said, is extremely important because the CDC even recommends, if someone's living with HIV, their health outcomes will be better if they know someone else who is living with HIV and can help them, right? And so having that community is really important. And over the past however many years America has existed, we have done a really poor job at developing community in our built environment. So one of our social determinants of health is our built environment. And the built environment that we've created are just sprawling roads, and we don't know our neighbors, right? And so having a community and getting to know your neighbors so that they can help you and you can help them really helps expand our knowledge of one another. And it helps expand our willingness to assist one another, no matter who we are, right? And I think that is a huge step forward and another way to view mutual aid as well, because folks living with HIV, we experience those disparities. Now, I want to mention something else. So Eric Kleinenberg, he wrote a book on the 1995 Chicago heat wave. 700 people died in that. But the number one indicator that a person would die or not, whether a person would die in that heat wave or not, was whether they were connected to their local community. That was our number one indicator. And so I think that having that network of care, yeah, we might live in really disconnected, very disconnected car-centric society. However, if we can reach out and get to know our neighbors and get to know folks who are also participating in this mutual aid, that likelihood of people surviving any other comorbidity is much higher.
Wow. Yeah, that's jarring, and we need to really work again on having these mutual aid networks and countering isolation. So thank you all. Should we do Q&A or maybe some closing remarks for the recorded part of the webinar, and then we can move on to an interactive discussion with the people who joined us tonight. Anybody from the team? I haven't been monitoring the chat or okay, why don't we have uh like closing remarks, just something uh some last words for the recording from all of our panelists, and then we'll interact with the people who joined us tonight. So Tori, please.
So I love what I'm hearing from each of us, and especially what John said about you didn't use these words about finding community, but that's what I heard. And I think, and it's something I put in the chat also, that knowing other people living with HIV is a great way to share resources and information too. In addition, knowing other people who are living with HIV decreases self-stigma and can really impact overall health and health outcomes. What happens is, if you move to another, excuse me, a new area and you happen to be a person living with HIV, you probably don't know medical providers. You probably don't know food banks like I've heard Broderick and John both mention. You may not know where the bus is that gets you to and from your doctor's appointments or gets you to the supermarkets in your area that actually has fresh, good groceries and good meats. And so, and in addition to that, what I have noticed is from living in different parts of the country and working in all parts of the country, there are people who have access to medicines that some folks in rural places don't have, or in less populous places. The injectables are a great instance. There are people who don't have access to injectables because it's not on the formulary yet. Talking to other people who are living with HIV, creating community. They're great ways to get the type of resources that are needed to live healthier. And I hope everyone, and being able to share one's status with someone who gets it is probably one of the most liberating things that any person with HIV could ever experience. And so I highly recommend it.
Thank you, Tori. Absolutely. And then if you're living with HIV and a disability, double stigma, definitely find your people, and hopefully we can facilitate that. We'll have a conversation later. Uh, Broderick, please. You're muted.
This was just a beautiful thing to be a part of. I started this journey with WinCat, Western North Carolina's AIDS project, and it really taught me so much about what was needed and how I could best serve people that were experiencing the same thing that I was experiencing. I've always known how to advocate for myself, and I've always been pretty high functioning. So when I meet other people living with HIV and they're on this journey, it is such a privilege to be able to share with them the things that I've discovered and watch them grow and advocate for themselves and to share what they've learned. And being a part of this just reminds me that I have to be more active and do more of this because everyone has been so knowledgeable and it's just been beautiful and it's been wonderful to be a part of.
Thank you, Brody. Sylvester, please. Sylvester. If not, John.
Sure. Tori mentioned, getting to know folks living with HIV is liberating, and sharing your status is liberating. It absolutely is. So, and thank you for mentioning that. Um, and another word I like to attach to that is bridging social capital. I think when we are able to get to know one another and get to know some folks outside of our circle and within our circle that we didn't know before, that bridges social capital and lets us better connect with our community long term. Even though let's say I know Broderick, right? But I might not know his friend, but just having that social connection is invaluable. Because at one point, Broderick's friend might be able to help me, or I might be able to help Broderick's friend, right? With it, whether that be with a diagnosis or what have you. And so, uh, I think that mutual aid aspect of it, bridging that social capital and getting to know one another, and getting to know your neighbors, getting to know your neighbors. I can't stress that enough, but getting to know the people in your most direct community. Now, that is a privilege in and of itself. I will say that. But getting to know the folks within your local community can really uh, help once bridge that social capital. And it helps connect the community at large. And a community becomes more interconnected than we ever have been in the history of our country, at least. Because at one point in our history, we always used to help one another, give one another food, and now it's all about this. It's about the money. And so if we can reach out and reach a helping hand to our neighbors, I think that's what will save us all. So.
Thank you, John. And we have Sylvester back.
Hi, everyone. I'm not sure what happened to my internet. I wasn't able to get back in through my computer. So I'm coming in through my phone. What are we discussing right now?
Just some closing remarks, some hopeful things for the future before we move on to like a more open conversation and we stop the recording. Yeah.
I just wanted to say thanks again for this wonderful opportunity. This has been a great conversation from several different viewpoints. I think we've each uniquely brought our own perspectives, but that it is a collective of information that can be used by anyone that's listening. And I look forward to more conversations like this in the future.
Great. Thank you. So please, everybody stay. There is very quickly, there is a survey. If you could help us fill out this survey, it would really help us with our programming. Let me share the screen so you can see it. There's a QR code. There's also a link that will be put in the chat. So just fill out the survey. We're going to stop the recording. Thank you for joining us.